The main symptom of relationship trauma is really a loss of trust in relationships. A loss of trust in the safety of relationships. The earlier relationship trauma happens in our lives, the more likely it is to have a damaging impact on our minds. And relationship trauma that happens between ourselves and our caregivers is often the most damaging at all. This is Nikos Tsigaras, counseling psychologist, intensive short-term dynamic psychotherapist, and specialist in relationship trauma. So in today's video, I'm going to try and list, in a way, a few of the symptoms of relationship trauma. Now, relationship trauma is not the same as relationship PTSD, and that is probably another video in its own right. It can look like many different things. Now, let's just think for a moment about the context in which relationship trauma occurs. And let's take adult relationships, adult traumatic relationships. This trauma can happen when your partner threatens your life, where they're physically violent towards you, they're sexually violent towards you, they frequently put you down, they frequently try to control you, or make you feel like your version of reality is non-existent. Now, I need to sort of make a statement, really, that's going to be very relevant for all the videos in this channel, and that comes from intensive short-term dynamic psychotherapy, which is I practice with people, or ISTDP, and that many of the symptoms of psychological distress have to do with not allowing ourselves to feel our feelings fully and deeply. And when it comes to relationship trauma, it usually is the case that we weren't really able to allow ourselves to feel our feelings fully and deeply about what happened between ourselves and the other person. So in a way, emotions are never the problem, but it's rather that we experience anxiety because of them, or we put in place a number of defenses in order not to feel them. Now, if something truly awful has happened to you and you haven't quite allowed yourself, you weren't able to allow yourself to feel your feelings, and why this may happen is probably the topic of another video. You know, why we learn not to allow ourselves to feel our feelings. Now, if we don't, the first symptom is anxiety. This means, when will we get anxiety? Now, it seems that when there is relationship trauma, one of the things that happens that might be different from other types of trauma is that we are quite drawn to revisit the memories. And when we revisit them, we are going to have the emotional reactions that we had at the time. If you are being physically assaulted, it's entirely normal to feel anger and rage towards the other person. But if at the time you had assessed that this, in an unconscious way, that it wouldn't be safe for you to enact your anger and your rage, you may become anxious instead. You may indeed freeze. So these memories, they come back and they bring the emotion and they bring the anxiety response with them, and they evoke an anxiety response at this moment. And it's possible that we tend to go back to these memories in an attempt to master them. And that used to be the viewpoint of Sigmund Freud, who was the inventor of psychoanalysis. That quite often we tend to go back to painful memories because we want to process them. Of course, in reality, what happens after relationship trauma is that we get quite stuck in our minds in an anxious state, ruminating, going over those memories, but not really processing anything, because usually we need some help to do that. Being stuck in your mind now, you could call that rumination, you could call that another symptom. And that can be quite damaging in itself, because with rumination often comes self-blame. And when we start to blame ourselves about what happened then, we can start to blame ourselves about what's happened in other similar situations. When we don't really feel our feelings fully and deeply, we often put defenses in place, as I said in the beginning. And one such defense is helplessness, and it really surprises people when I point that out in therapy, but it tends to bring tremendous relief to them when we name that, when we name their physiological reaction in the session as helplessness, when a tear comes up and you start to feel a bit like a child, like you can't manage anything, like you're completely helpless and unprotected. And it's really helpful to say this is a helpless state, but what would you be feeling if you weren't going helpless? Similarly, hopelessness is another kind of defense, and this is about resignation. It's abandoning yourself, it's giving up on yourself, and sometimes you can see that with people as they slump over their head, looks down, they may be tearful, and it's, I will never have another good relationship, I will never get over what happened to me. And again, there's a really interesting question you can begin to ask in therapy, not quite in this way, but what would you be feeling if you weren't going hopeless? Another yet defense is hyper-vigilance. It's very automatic, but essentially you're kind of waiting to be re-traumatized. You're kind of waiting now for what happened to you to happen again. And what this can result is that you get cues from other people, for they may, for example, ask you a question, they may show interest in you, but that might remind you, for example, of being interrogated, of being examined, of your partner ask you questions about where you were, what you did, what you were up to. So somebody just asks you a question, what did you do over the weekend? And it's because of interest, and then your mind changes it into something dangerous. Playing it safe, you might even say. Someone in another scenario might not reply to a text message, and that might sort of come across as a rejection. I might even think, there's something broken about me after this relationship. People can see it. Maybe they're staying away. I said earlier that when we go to rumination, we can start to blame ourselves, and I should say this is also a defense. And sometimes it can look the other way. It can go into blaming your partner, which is different than giving them responsibility for their behavior. Because the thing about blame, whether it's towards yourself or towards the person that hurt you, it's really about punishment and about someone getting punishment. And especially when it comes to you, it's not really connected to any love for yourself. Right? You're just putting yourself down, or you're just beating yourself up that you didn't stand up for yourself, or that you stayed with this person, or that you didn't see the signs, and all those kind of things we might tell ourselves. But that can actually be incredibly damaging. It's like having somebody in your ear telling you, look at you, you can't get anything right, there you go again. Especially if you've been in an abusive relationship before. So I'm going to stop here for today, and I think that's already a super dense video. But if you stick around with this channel, I'm going to unpack a lot of this. I'm going to unpack how feelings can trigger anxiety, how we can put defenses in place so we don't feel our feelings, so we don't get anxious, and how that can happen specifically in after relationship trauma, as well as in other situations. So stick around.